I'm really excited that Daniel Webster has joined us. Not that Daniel Webster. Daniel is a professor at the Johns Hopkins Bloomberg School of Public Health and is the deputy director with the Center for the Prevention of Youth Violence. And we're really excited to have Daniel here, not only to be here today to support our initiative, but as importantly, the Bloomberg School and the Center are very interested in studying what we're doing, to learn how our community-based approach actually impacts this issue so that we can, one, make sure we're creating as effective a program here in Howard County as possible, but two, taking a look at the community approach and understanding how this can be a model for other places as well to get their arms around this issue. So, Daniel, thanks for joining us.
Thank you very much for the opportunity to be here at this really exciting event. I want to say some things that are obvious, but as a public health person, I feel compelled to underscore just what an enormous public health problem bullying is for young people, and a problem that can stick with individuals, frankly, throughout their whole lives. There's been a tremendous amount of research on bullying, the effects that it has on victims, and even on the bullies themselves. And just in terms of how broadly this young people are affected by this, most recent data show that 20% of high school students report being a victim of bullying within the past 12 months. And 16% say that has occurred online, in some sort of online manner. So this affects a great deal of young people in important ways. We know that victims are at increased risk for problems with anxiety, depression, severe emotional distress, and of course in the most severe circumstances, even suicide risk increase. There's also, of course, the obvious increased risk for youth violence to result from bullying. I'm very proud that Johns Hopkins and our Center for the Prevention of Youth Violence has really been a leader in studying the problem of bullying, but more importantly, studying and developing ways to prevent bullying for youth. Most of that activity has been led not by me, but my colleagues, Kathy Bradshaw and Phil Leaf, and almost the entirety of that effort has focused on the school environment, very, very important school environment. But what's so exciting about the initiative here is that we are really going to tackle this the way we have effectively tackled other public health problems like drunk driving. We didn't leave it to one institution to address that problem. We tackled that problem from multiple angles and had really tremendous life-saving effects as a result. And I'm hopeful that we'll have the same kind of results in a very multifaceted, community collaborative effort to really profoundly change social norms so that bullying is a very rare event, and when it does occur, that the victims get the support they need, and even that the bullies get the attention that they need. They typically have many underlying issues as well. So I think a number of things are put in place with this initiative are very hopeful, and as was alluded to, researchers are very eager to study new innovations, and we're optimistic that it will have positive impact. So thanks again for having us.